I'm so grateful. I'm so grateful that you've come to join us today as we talk about ethics and breastfeeding and research. It's quite an emotive subject, actually. When I was thinking about it, I remembered when I was having the children and breastfeeding. It's quite something, but yet we don't talk about it much. So today we'll have a full morning of talking about it in terms of research, in terms of conflict of interest, and we'll just delve into it. At some point, we'll have some case studies, you'll do some group work, and then we'll call it a day. So welcome everybody, welcome to Mombasa, welcome to Pride In, and welcome to this pre-conference session. We would like you to stay the whole time. This is our desire. But if you're going to get a certificate, you will need to have stayed the whole time. That is the carrot, but that is the stick. But the carrot is, there'll be a special surprise for the people who will stay the whole time. So isn't that nice? Great. So I'm just going to go very, very, very quickly through a short introduction because I don't want to take it for granted that we are all on the same page when it comes to research ethics and research. And I want to start by showing this lady who is breastfeeding, and I want to ask a question. Who is the research participant here? Just feel free to put up your hands. This is not an exam. I'm not going to mark you, right or wrong. Just feel free. If you were doing research, not you, Prof. Naanyu. Prof. Naanyu, you are not allowed to answer this question. Ubaguzi? Yes, Mutinda. You said you're Dr. Mutinda? Yes. The baby. So Dr. Mutinda feels that the research participant is the baby. Anybody else? Yes? You think both, the mama and the baby. There's another participant there, a silent one, yes? It depends on the research question. Okay, that's a very good thing you said. It depends on research, but let's just assume we're talking about research in breastfeeding and mothers. Yeah, let's just assume yes. Yes. The participant is the mother. For you feel the participant is the mother. Okay. And you have said the breast milk. Yes. Breast milk is, what would you call breast milk? It would not be a participant because it can't talk. But what would you call it? It would be a sample, wouldn't it? It would be a sample. It would be a biological sample. And we are forever exporting samples. And just think through it as we go along. What would be your recommendations, or what would you want to say when you're talking about exporting breast milk, yes? So this is the thing with breastfeeding research, is that you have a nursing mother, you have a baby, and you have the breast milk. And all of these things you have to take into consideration when you're doing the research. I don't know if you can read that, but there's something about breastfeeding and mental health as well. Now let's move on to the mother. And can you read that? Can some people read out some of the things they've said there? I don't want to read it myself. Anybody? Oh, welcome. That gentleman has walked in. Welcome. It's not really 2/3, but we are very grateful. Anybody like to help me read that? Breastfeeding is hard, and then somebody's, can you see it? Is it too small? It's too small? You can't see? All right, so let me just read for you then in that case. So I put a lot of pressure on myself about breastfeeding. When my baby cries, it's even harder to figure out what I'm doing. Breastfeeding puts a big part of the parenting load on me, and that's scary. It didn't come as naturally as I expected. My nipples hurt and latching is hard. I didn't feel prepared for this. I don't feel like I know what I'm doing. Sometimes breastfeeding makes me feel like I'm on the clock. I feel like I'm feeding my baby all the time. People share a lot of opinions, and most of them are not supportive. I'm often worried about if my baby is eating enough or is gaining enough weight. So you're pediatricians, many of you, I presume. But even if you are not a pediatrician, haven't you heard these stories? Yeah, with young mothers. And you know, these days we have senior mothers. Still, a senior mother who's getting a baby, maybe over 40, would have these issues. And this is your research participant. So you can see why we have a whole session to talk about breastfeeding, don't you? I mean, it's a little bit different from any other participant. They are in quite a delicate time of their life, yet we need information about them. Yet we need to understand why they're not breastfeeding for 6 months exclusively. Yet we need to understand whether they should be able to breastfeed when they have HIV or not. And so that is how come you end up having to have a framework, a whole framework. People might be asking, why would you have a framework just talk about breastfeeding, but you're now beginning to get a clue? It's because of the research participant. And of course, the baby is also very vulnerable as well. And Violet is going to talk about that. So that is it. The reason why we are having a whole session to talk about ethical considerations in breastfeeding research is because of vulnerability. And Violet is going to go into quite some detail about the nature and dynamics of vulnerability. And it is being defined as susceptibility to harm. That is what we are going to define vulnerability as. And so we have to be so careful when we are doing research with breastfeeding moms that we don't coerce them, we don't exploit them, and we don't disrespect them, even as we are trying to get our data. Just as an overview, what is ethics? It is the formal study of what is right and wrong, the study of the basis of or principles for deciding right and wrong, and the analysis of the processes by which we decide what is right and wrong. So ethics and morality is very different. With morality, you don't have to explain why you feel, for example, abortion is wrong, okay? You don't have to explain it. In the news right now, we're talking about Ezekiel, and we're talking about the young people who have entered into his religion and what is happening to them. If I was to take a poll here and I say, what do you think about what Ezekiel is doing? You know, people say, I think this is just terrible, or I think this is okay. But you don't have to explain why. That's just what you feel. That's what morality is all about. However, with ethics, you must say why you feel it is wrong, or you must say why you feel it is right. And that is why we say it's the study of the basis or principles for deciding right and wrong. So you will be given principles. There's a framework we're going to be using towards the end of the day, and you're going to have to explain to us why you feel whatever you feel about what you're going to be what you're going to be discussing. Of course, research ethics is specifically interested in the analysis of ethical issues that are raised when people are involved as participants in research. So we are looking at what comes up when you're doing research on a vulnerable mama, on a breastfeeding baby, or on breast milk. I can't give an overview of research ethics without talking about some of the things that happened in the past that make us want to become ethical researchers. Breaking and rebreaking of bones to see how many times they could be broken after healing failed to occur. That happened during the Nazi war crimes. Patients injected with liver cancer cells, and these were old patients who could not speak English. They were Jewish, and they just wanted to understand what happens. They're trying to figure out how people get cancer. 400 men left to suffer with syphilis long after a cure that was penicillin was available. I'm sure you've all heard of the Tuskegee, Alabama, 1932 to 1972. That's 40 years of doing research in the most awkward and manner. And finally, the Milgram study sustained no physical harm, but they suffered shame and embarrassment for having behaved inhumanly toward their fellow human beings. Now, this was a study. They were trying to understand why the Nazis behaved the way they were, and they wanted to see whether people would just follow orders, whether or not if they were doing a wrong thing. So they would make them increase the pain for other research participants, but actually they were not increasing the pain. The people who are the participants were pretending to be in pain. So the people who are the participants were actors. But you, as the person who was in the study, you are being told, this is not enough, this person has to suffer, increase the voltage. So it was a voltage, it was something that you pressed like a button, and then the actors would shake and scream. And so they kept on because they were trying to understand, would an otherwise good person just become bad because they were following orders? But at the end of that study, the people who were in that study had suffered trauma in the mind because they saw a side of themselves that they had never seen before. So it was not physical harm, but it was mental harm. Again, here we are. We have a research participant who is a baby a mom and the breast milk that is the sample, and you need to be careful that at the end of your research, you don't leave them with many more questions in their mind than they had before. This is what happened. Them days, we hope that when people are looking at us 30 years from now, or 50 or 100, they'll find that we were ethical. These are the principles you're going to be talking about. Autonomy, and I know many of you are medical doctors, so some of them are very similar to medical ethics. Autonomy, which would be the application would be informed consent. Beneficence, which would be to do good. Non-maleficence is to do no harm. Justice is to be fair as you enroll your participants. Veracity, which is to tell the truth. And fidelity, which is to be committed to what you're doing. Veracity and fidelity I love to add because you will be researchers as well. So you need to have integrity and you need to do your research in the appropriate way. And I think this would be almost my last slide. Towards the end of this session, we're going to ask you to look at some case studies. And if you've never made decisions in terms of ethics, you could use this method. It's called deductive or principle-based reasoning, where you start with the ethical theory. We've not talked about theories, but let's just move with the principle. And we shall ask you to look at those case studies and see whether they went by the principle of respect for persons, the ones I showed you before, autonomy, beneficence, non-maleficence, veracity. That's what you're going to be looking at. So you start with the principle, then you develop rules, and then you make a judgment. So you're going to make a judgment in the hour that we give you as to whether these people were ethical or not ethical, and you're going to explain to us why they were ethical or not ethical. Saying it in a different way, you have the ethical theory, the principle, the rules, and the judgment. So that's probably what you're going to be doing later today. And a good beginning makes a good ending. So I went very quickly just to set the stage, but Violet is going to come and go into much greater detail. Thank you for your attention. I now want to hand over to Professor Violet Naanyu.
Like I said, I'm from Moi University. My name is Violet Naanyu. I've been there about 26, 27 years. And my friends keep asking, how do you kuandika application letter? How come you've never left? I'm just one of those who stick. I'm very passionate about this issue. Like I said, I'm a mother, a Kenyan mother too, so I'm aware of our context, our norms, and all these principles that Carol is talking about. And I was asked to come and talk about it within our context. This is a conference, so I'm expecting a dialogue. You have so much more information that I can bring to you. So we're going to speak to one another, and when we go into the groups, we want to spend more time there. I was asked to focus mainly on vulnerabilities. Bringing this particular participant as a vulnerable participant. How many of you, I know you're involved a lot in clinical work, but by show of hands, how many are in any type of research right now that's ongoing? Any type, social research, clinical trial? 1 person, 2 people? Good, quite a number of people. I'm curious to know how you define vulnerable participants in your study, but just quickly, who is a vulnerable participant in any study in Kenya? You don't have to explain it. So we were told there's ethics and there's morality. Don't explain it, just tell us, this category I think is vulnerable. Anybody to share? 1? Prisoners? Infants? Pregnant women? Mentally ill persons? Any other vulnerable participant in our context in Kenya? No. Any other vulnerable participant in your opinion? People from? Impoverished communities, which is like 90% right now in Kenya. Things will change. Nothing lasts forever. Even the Bible says, and it shall come to pass. Any other vulnerable categories you see in our communities? Yes, please. Politician? Pardon? Street families and street children. So the concept of vulnerabilities is not new. And I wanted to start there because in all the ethical guidelines, global ones, Kenyan ones, even the ones we have in our ethics committees, the vulnerable participant is often flagged uniquely. And I was asked to speak to you about breastfeeding and breast milk and the issue of vulnerability. And my sister here, Carol, we do a lot of work on bioethics with her. And so she's already touched on most of the things so I will gloss over some things, and you can ask me questions according to need, no problem. So I'll talk about vulnerabilities, just the definition, so that as we talk about this until we finish, we have the same mindset. I'll talk a bit. I'm glad to hear one of our members is actually in programming for issues around breastfeeding, because we were asked to talk about research, but also programming. All right? And then we'll talk a bit about specific ethical considerations when you're dealing with breastfeeding, but also when you're dealing with we've called it now a sample, a very unique, special human sample, the breast milk. All right, what is vulnerability? She said that inability to protect yourself in the face of harm, inability to cope, all right? So we say having possibility of incurring identifiable harm, which while substantially lacking ability or means to protect yourself. So keep that in mind when we are thinking about the list of people we have just said are vulnerable populations in research in Kenya. And remember, the nursing mother is one of them. And we've been told infants are there. So we have both participants listed as vulnerable participants. So how do you, as a pediatrician, writing your protocol, inform the ethics committee about that part? If you send that protocol to me, I serve on 2 ethics committees in this country. The Aga Khan one. Watu Aga Khan mpo? Hallelujah. All right. And I also serve on the one at Moi Teaching and Referral Hospital and the College of Health Sciences. Anyone from Moi? 64? Karibu? All right. So we are home. Yeah. So when the protocol comes, we want to see that the PI thought about the vulnerable participant and they have considered, reflecting, are they from Kilifi? Are they from Madare? What are the vulnerabilities, besides just being a nursing mothers, about that context? And how you're going to identify them, recruit them, consent them. What will the consent process look like? I do a lot of work with the Aga Khan teams in Kilifi, and there's that concept of mwenyewe. Do you know the concept of mwenyewe? Who knows about mwenyewe? It's very important when you're talking about mothers and nursing. I saw someone nodding. Tell us, what is the mwenyewe concept? The husband. It's a strong, isn't it? So when we will be looking at our case studies and discussing this issue, I was waiting for someone to say, when she asked who are the participants in this slide, I was waiting for somebody to say the father. And in some places, who else? The mother-in-law, not any grandmother. The paternal, the mother-in-law, where this, anyway. So you see, I told you, you're full of this knowledge. So when you think about vulnerable populations, we've said it's disadvantaged subsegments, and she gave the example of street families and all that. We are talking about, you've given me examples of who is vulnerable that you're in within our context, and we have talked a bit about why we think they are vulnerable, and I will go into 4 key things that define a nursing mother is vulnerable in our context. The first one, we call it when a participant or this individual is under the authority of another person. So you'll find number 1 and number 2 are closely related. There's a submissiveness happening. So if an adolescent mother is under the care or directions of her mother, or a young wife, she talked about some older women getting babies when they're seniors. Those ones, don't joke with them. They'll tell you, leave me alone. I know what to do with my breast and with my baby. But young mothers, I remember myself just newly graduated from the university, gotten married. I have a baby and a mother-in-law who is full experience. So when she speaks, you just, you go into the corner and say, yes, ma'am, I'll do it. Yes, asante, asante. So when you're talking about being under official authority or any other type, you've seen breastfeeding mothers in the prison there in Langata, isn't it? So she's nursing. She has a baby, but there's a warder above her. What does that mean? When you write a protocol and your study participants will be breastfeeding mothers in the Langata Women's Prison, you have to think about those things. What about the influence of that grandma in that village or that traditional birth attendant? These are very key people in a lot of our communities where after we've seen the mother, she's delivered in our maternity, that's where she retreats to. She spends most of her time there, and that advice we know matters and affects them. Even the advice of physicians and friends. The other thing someone talked about, impoverished backgrounds. Economic and infrastructural vulnerability. When people are of low socioeconomic status, when they have a lot of limitations, you find them vulnerable and they are likely to be induced into certain behaviors. So you have to keep that in mind when you're thinking about vulnerability and nursing mothers and issues about breast milk. I may donate my milk because I'm poor and that's all the resource I have that I can give and earn an income. That makes me vulnerable because of my SES, isn't it? So you have to think about vulnerability from all these aspects when you're thinking about the participant Carol shoulders. Tuko pamoja? We are together? All right. And when you see the slides, you'll find some links to some readings that you can explore further these concepts we are talking about. She talked about research. We were asked to talk about breastfeeding, breast milk, programming, and research. So I can't, and as you can guess, I'm a teacher. Ishaonekana tayari. I can't live here without talking a bit more about research. Allow me. I am from the Empath Consortium in Eldoret, where we are working with more than 15 universities in North America. So, and we are doing a lot of research. And I'm aware quite a number of you, one way or the other, have been touched or touched Empath. I've been there since inception. And one of the things we are doing is trying to ensure the research we are doing in Western Kenya is informed by priority needs, that things we observe in the clinics apart from what the sponsors define as the research they want to support. Why are we doing this? We say we want our work to find new discoveries, new knowledge, not only just for the sake of a nice academic article and conference presentation, we want to inform policy. So a lot of the government of Kenya policies on HIV have emanated from work done in Empath. So we want to see more work by pediatricians around breastfeeding and breast milk. And now I know there's someone from Eldoret in the house. Amen. I'm excited. Okay, the religion thing is in my head. Yeah. But research means there's already knowledge. And I always say, when you do a PhD, my friends, you're only adding a dot to a very big ocean. Sometimes people get PhDs and their working style even changes. And if you call them by their first name only without the title, they get very offended. But the point is this, there's already so much knowledge out there, you're adding your special dot to that bubble, all right? So if it's not adding a bubble, it's not research, my friend. Don't waste time. And time is the greatest resource any of us has. Do work that makes a difference. Do work that will inform policy. Do work that makes you, it's Monday, people don't like waking up at Monday 6 a.m. You want to wake up and run because you're excited about the work you're doing. So it's a systematic and scientific approach, and that's why we have, I didn't say this, I serve on the National Bioethics Committee, and we've been accrediting ethics committees across the country. We have now about 36. And we are so excited to see more committees coming up in our institutions to help improve the science and the ethics in the protocols coming through them. Why? Because it's not often that we get an opportunity like this to sit down and talk about how to write a scientific research protocol, isn't it? Our training is full of so many modules. We don't give enough attention to that research methodology class. It's glossed over, but there's so much on that calendar. So when you have an ethics committee look at your protocol, they help to ensure there's a dot you're going to add with your work, and that the process, the implementation plan you have, the study design you have is scientific, so that the money you're putting in, the work you're putting in, karibu, sorry, another one from 64. Thank you. But the point is this, there's a process to it. It's a scientific process, but the ethics matter. The ethics matter. Your study design and the ethics go together like this. There are times I review a protocol and it's a fancy clinical trial, and I send them a page of comments to you. I say areas for improvement of this protocol, and sometimes the comment you get back, who does she think she is? She's not a clinician. And I say, no, with all due respect, we usually say, Unethical work is what? Who wants to pass unethical work? We've seen a lot of journal articles withdrawn after some time, isn't it? Written, we're using them even to improve, to change how we are delivering care. But it was missing something. Either there was some fabrication or falsification, or there was just something about the design that was not right. So what are you going to do with all that kind of work? The sponsor has given money. You've given your time, maybe 2 years of work. You've been given a PhD. We've seen quite a number withdrawn. Or maybe, I don't know that there's a session on research misconduct during this KPA. It's an amazing opportunity to hear stories about bad work and how we can make it better. But the value or the benefits of research, we've said, it's you as the moral person. The integrity of the PI is so important. And that's why I'm giving this talk today. When you think about breast milk, when you think about the nursing mother, how can you make your science, what we were saying, we want to establish facts, to analyze information scientifically, and reach new conclusions. Remember the dot. You add a dot to the knowledge that exists, and you proudly come to a conference and say, this is my work, I did it ethically. I got consent from... When there's a study we're doing, and it's a multi-country study, when they went to Uganda, the lady said, can I take this document home? We have to go discuss it at dinner with the family members. If they say it's okay, I'll be back. But I like what you said. So you can say she's already consented as an individual. But we have cultural ways of doing things. There's a process of decision making. Do you as a PI want to respect that? If you want to, then you have to capture it in your protocol when you're programming and when you're writing your research and doing it. So what are we saying? We want a moral plus ethical pediatrician. Have your own views, have your own beliefs, but also think about the 5 points that Carol talked about. Be upright, be factual, be fair, be decent, be transparent, be confident about your work and say, I looked at all the designs out there, I got the best I could find for this particular protocol for this village in Kilifi. And all the ethics around doing my work in Mathare or doing my work in this 64 village, I have taken care of that. I've done community entry properly, and I've recorded everything I've done correctly. Let's do it right. And I'm so glad that your association is so powerful and that you meet annually. This is amazing. I think the science in Kenya, there's hope. There's hope. And I saw this kanga. Did you see what it says? Hata ikilia radi, sibadilishi ahadi. Even if the lightning strikes, I'm not changing my stand. This is what we're talking about. Being researchers of integrity, being moral, standing strong and saying, this is what I've learned about breastfeeding. This is what I've learned about how to do research around breastfeeding and breast milk. I'm more moving. Hata ikilia radi. I really liked that. So research ethics, allow me not to spend time on this one because we've talked about it, but 3 objectives in research ethics. The first one, to protect Wanjiko. To protect that baby we saw, to protect that mama, to protect that milk. Especially because it's a good you want to be used by the next neonate or the next infant. So protection of the human participant and end user should be at the core. The second thing, whose interests are you serving? We've said these are vulnerable participants. Why would you involve a nursing mother in Langata prison in a study if in the end the findings of that study won't benefit her or her type? You're bothering people who are already vulnerable 1,000 ways. You would just call Violet, okay, I'm not breastfeeding anymore, but so we say you have to justify to the ethics committee why that particular very vulnerable person is involved. And one of the ways is to say, I can see how at the end my study will do X. At the end, the program that maybe she will write around this will benefit her. At the end, I'm hoping to have a policy brief that will inform X. You see what I mean? I want to inform breastfeeding guidelines in the prison or something like that. So it needs to serve their interest. And the last thing, the soundness. We've said the soundness of the methodology is part of the ethics. If it's not good, it's not ethical. It's not ethical. So you have to make sure the fidelity of the study, it means how you said to the ethics committee, this is how I will implement. You actually do it. nurse fidelity. You implement it the way the protocol was approved and said it's okay to go ahead. All right? And you meet every step, and then the confidentiality, these ones you already know, and the consent we've already alluded to. So I knew I would talk up to now and then say I want to drink some water. So this is the part where I wanted someone talk to, guess what? Someone said they want to hear about breastfeeding and HIV, and I said, you see, niseme hallelujah tena. I said that there's a case I brought. I think we didn't get to, did we print it, or are we projecting it? Okay, it's, or shall I just quickly read it? I don't know. That's why I brought my laptop. And I'm sorry to be a bit boring. Just imagine, I'll try and be interesting. It's not very long, but it's a case about, from the WHO list of cases that they use for, let me see. So I would like us to pay attention, and you can scribble as I tell you about the story. It's a true story. It's a bit old school because there's been a lot of change about to breastfeed or not to breastfeed exclusively when you have HIV, isn't it? And I think you have more knowledge about that than I do. But this case still brings out important bioethical issues to consider. So this case is based, and oh, by the way, the LactaHub link, when you go later, you will find all the material that he talked about, including this case, and you can use it later. This case is based on research that took place in the 90s and is not based on reasoned knowledge. It's included here because the ethical questions remain valid. A research group based at a medical research institute in a Central African country is studying the risk of HIV infection in children who are breastfed by HIV-infected mothers. Should breastfeeding by a HIV-positive mother prove to significantly increase the risk of infection in her infant, existing Ministry of Health recommendation that mothers should breastfeed regardless of their HIV status would have to change. Findings from a previous study suggest that breastfeeding might be associated with an increase in HIV transmission. However, that study had some design flaws to the investigators. So the investigators at the Medical Research Institute believe that the study needs to be repeated. The research is being undertaken at the city's general hospital over a 1-year period. So the first thing about the study design, it's a 1-year study in a health facility, okay? With the belief that pregnant women and their partners should jointly make the decision to participate in the study. See the players coming up, all right? The researchers seek informed consent from both partners. The consent forms are clear, seemingly comprehensive, and include a clause stating that the participants can opt out of the trial at any time without compromising the health care at the clinic for either mother or child. The researchers offer no inducement to encourage participants to join the study, although they are very aware, all right, both that antiretroviral drugs are not readily available to most of those who need them in the country, and that there is no preventive mother-to-child transmission program in the hospital. At the third trimester, prenatal visit for an in-hospital delivery, every participant, remember it's a 1-year, pregnant mothers, every participant has blood drawn to determine their HIV status. Before delivery, the women learn of their HIV status. Those who are found to be seropositive receive counseling and are advised not to breastfeed their infants. The counselors assure them that all the infant formula they need will be provided to them free of charge. Nevertheless, some of the women choose to breastfeed, thereby providing 2 non-randomly selected groups: the HIV-positive women who choose not to breastfeed, and the study group, and the HIV positive who choose to breastfeed compromises, they become the control group. The HIV status of every child, whether they receive breast milk or infant formula, is assessed at birth. And every 6 months, up to 18 months, all children in the study are seen at least every 2 weeks in a special clinic where drugs for common childhood illnesses, as well as HIV-associated opportunistic infections, are available free of charge. So, as I come towards the end, One of the women seen in the prenatal clinic at week 24 of pregnancy who had tested positive for HIV is a healthy 32-year-old married woman with 2 healthy children, 2 and 5 years of age. Her medical history shows that she received a blood transfusion after a postmortem hemorrhage during her last delivery. According to protocol, she is informed of the general benefits of breastfeeding and the countervailing risks of HIV transmission. Her physician advises her to consider alternative options for infant feeding. A week before her expected date of delivery, after several difficult discussions with a healthcare worker and her husband, she decides that she will breastfeed her child and will continue to participate in the study. Her husband strongly objects. Okay? Her husband strongly objects. Macho inaanza kuwa mzee. And decides to approach the investigator to try to change his wife's decision. He states that he has equal rights to decide whether the child will breastfeed or not. And given his understanding that breastfeeding will probably be a danger to his child, he will seek an order from the court to prevent his wife from breastfeeding. He wants his family to remain in the study as it's the only way that they will have access to sufficient quantities of infant formula as an alternative to breast milk. That's the case. It has a lot of things going on, isn't it? Do you have this type of scenarios? Yeah. Now, these are the things that I was trying to flag from it, and there are 4 main questions from that case that I found useful. The first one, since only the woman's HIV status is relevant to the risk being studied, is it appropriate to seek consent from both the woman and her partner? Maoni, what do you think? Yes, please. Mm-hmm. How does it affect the man? Mm-hmm. Mm-hmm. Mm-hmm.
They can also he can protect himself. They're both stakeholders.
Uh-huh.
Yeah.
Maoni. I see another hand there, and then at the back there, then we'll come this way.
So Helen Abwera from Aga Khan.
Karibu.
And I think in an ideal situation, as my colleague said, yes, that's in an ideal situation, but certainly in my experience, it's not always been so rosy whenever women receive that HIV diagnosis. And it actually makes them quite vulnerable to either being chased away from home, being, being exposed to domestic violence. So I think the challenge here is women who are already vulnerable become even more vulnerable once they get that HIV diagnosis.
Mm-hmm.
And I think as a research study, we have a duty of care to see how we can protect them from that.
Mm-hmm.
As you said, there are no right or wrong answers here.
No.
But I think that requirement to invite the husband into consent with her probably will make her even more vulnerable.
Mm-hmm. So you're saying inviting the spouse to be part of the consenting process makes her even more vulnerable.
Yeah.
Uh-huh. I saw an opinion.
And could probably actually exclude her from that study. So women who would have joined your study and benefited from that process may not do that.
Mm-hmm. I saw another hand at the back there. 2 hands. Thank you.
Thank you very much. I think involving her husband, first of all, takes her autonomy from her. She has to make a decision. She's not being given a chance to make that decision to invite someone else into the decision making. Number 2, the husband's opinion, though very important in this situation, because if she chooses not to breastfeed, of course, there will be questions. There has to be a way of how to bring in the husband, because he is also a stakeholder. So quite interesting situation to be in.
Stakeholders and their rights.
It is unfortunate that sometimes paternity has to actually be established. That's the first thing. It's unfortunate, but it's true. So there's a perception that I'm the father, right? May not be true. However, what is the outcome of that study? The outcome is HIV in the infant. So if I'm the father of that child, then I have a right to decide what is going to happen to my child. Because whatever happens to that child, I will be involved thereafter. So all the things that we are talking about are actually very relevant for that lady. However, the father of that child actually has a say in the health of that child.
So how do we define a father? Is it genetic only? No. Anybody from this side of the room wants to tell us? You will go to, yes, then we go to the next question. And I see two people. Thank you.
Thank you for that. That's actually my first question. Who is the father? And then now, together with that as well, is he aware of the status to begin with? Because conflict may just start from there. So those are the two issues that I'm battling in my head. Yeah.
I also thought that not every woman is married. So for those who are not married, are they going to be excluded from the study? And also I was trying to define, can we define a support person as a support person, not really a husband, but someone who the mother can say, this is my support person.
Any fathers in the house? I'm waiting to see if a father will say something. Yes, thank you.
I'm not yet a father. I have a wife. But my question is, for all of these studies that are being done, this is just a monogamous family. I come from a place where polygamy.
Yes, the context matters.
Yes. So if we are saying that from some of our members that informing the father will increase the vulnerability of the mother. What about in a case of polygamous marriage, when one of the wife is HIV positive? What about the other wives? What about the other children of the other wife?
This is our Kenya, isn't it? We said we take these guidelines and these stories and this research and ideas from the north and from the south, but when it gets to Kenya, we step and say, this is Wanjiko in her village or in her urban area. What does this guideline mean here? What does this decision-making process about breastfeeding, about breast milk mean in Pumwani Hospital? What does it mean in KNH? And I like that because he just reminded us, someone has asked, who's the father? How do we define mothers? We have a lot of, fathers who adopt. I mean, there are all kinds of definitions. There are all kinds of family setups, as our to-be father has told us. Thank you so much for sharing. So, question one is really, really important. It's about, I like the keyword Dr. used, stakeholders. You need to, who are all the stakeholders required in decision making about that study before the consent form is signed or before the breast milk is expressed and stored and reused? What kind of consenting is going on even with the recipient side? You're going to give that neonate milk from the breast bank. What does the father, what do the stakeholders have to say about it? So we have to keep that in mind. What if the woman living with HIV does not wish to reveal her HIV status to her partner? Now the issue of polygamy comes in because it has implications. What does the guideline in the nation say about HIV infection and what a healthcare provider's role is when you find out some of this information, which is confidential, but there's a public health issue to it? So many dilemmas. And like someone said, no perfect answer. We have to make a decision. And I'm glad to see Aga Khan University and Hospital is doing so well with their hospital ethics committee. I really commend you because you've become like a guiding light for the other facilities in the country. So those are the dilemmas that happen, and a space like that, a committee like that helps the family and the healthcare workers come to a decision that is good for the baby and for the mom. What is number two saying? What role should the husband in this case have? I think we've touched on that in the decision about whether or not to breastfeed, given that it could seriously affect the child. I think we've touched on that. Number three, given that a previous study had already shown a risk of HIV transmission through breastfeeding, is it appropriate to run a study like this? You remember there was breastfeed vis-a-vis don't breastfeed. So these are very, very important questions to think about. How much knowledge do we already know about the issue of mother-to-child transmission? You need to have done a thorough literature review before you tell us, I'm going to add a dot in knowledge. Remember our dot, eh? We carry it until I finish. And then you make sure you know what's the current status and this journey, where have we come from, and the decisions that have been made along the way on the policies for feeding infants. And the last one was the risk-benefit ratio. Do you see any way to improve this ratio? What are the benefits for this mom and child getting involved in this study? Some were mentioned in the case. What were the benefits you saw? There was free something, eh? Some things were free, hapa na pale. Yeah? Yeah? So there were free feeds for babies, isn't it? Remember there was a control arm and yeah, the exposed arm, eh? So there was the fact that there was something usually very expensive being provided for free for a long time, and you say, oh, my baby will be fine. After all, on the third month I was going to introduce something else or something. Let them, there are all kinds of reasons going on, isn't it? So when you think about the risk-benefit ratio, remember what we said about involving vulnerable participants. You need to be sure at the onset that this research is going to be beneficial, whether during the research, but definitely thereafter at the end of the study, it must benefit that particular vulnerable participant so that the ratio can be fair. Otherwise, quite often, the ethics committee will also query that and send it back to the PI and ask you to go back to your work group and reflect on how you can make it slightly better. And sometimes we will throw in a few more things to support that. We proceed? Any question? Sorry, the case, I wish you had it before you, but I hope you were able to follow. How am I doing on time? Yeah, 20 minutes. That's all right, because now I wanted us to at least talk about that case and then quickly start seeing some things that come up. On this slide, we were asked to think about ethical considerations in research and interventions where you have to do with breastfeeding and breast milk. Now, in the A list, I put question marks because I leave it open-ended. There's so many other things you can add to this list. But when you're thinking about research on breastfeeding, and some of the things have come up, autonomy has come up, informed consent has come up, spousal or mother-in-law or the other significant other, the stakeholder, I liked her word, has come up, all right? We know about the beneficence, the mother-child bonding. We know what breast milk does for the mother, having breastfeeding, and also what it does for the baby. You are the experts on that. We won't dwell on that. Some talk about women's empowerment, making decisions about breastfeeding or not, and how to deal with that. And then compensation has come up, and benefit sharing. So, and when you look at the breast milk itself, I saw some studies showing that in our urban areas, at least 44% of newborns are often separated for 1 to 6 hours periodic, between the mom and the baby, all right? And 14% end up being fed on mom's milk. We said 44, all right? 14% are fed on mother's milk. 36% get no feeds during that separation period, and 23% get some formula. So do we have a problem statement? We do. This is why we're talking about breast milk. How can we bridge this gap so that 36% of the babies are not left without a feed because the mother either has had surgery or something like that, or something's going on and they have to be separated from the mother? So you have to think, when you're thinking about that breast milk nonetheless, you have to think about autonomy. What does the person giving the milk, and even the person receiving the milk, have you respected their autonomy and decision making about that breast milk? The informed consent comes again. We know about health risks. Yeah, the milk we need to be sure of the quality of the milk. And is it pasteurized, vis-a-vis sterilized, and how much is still left that we can say is valuable for the little one? So those things about quality, and then of course access and equity. Can all the moms, irrespective, can every infant who needs it get access? How can we increase that, irrespective of the type of mom socioeconomic status, insurance status. If we think this is a human right for the little one, and there's a breast milk bank at Pumwani, can every infant who requires it be prioritized, beginning with the preterms? Those are some of the things to think about. What about cultural norms? Maziwa ya nani? Which milk you're giving to my baby? You know, those conversations with the stakeholders come up, don't they? So how do we take care of that to ensure that our programs, if it's programming or it's that nurse in maternity arranging for the breast milk to be given to this neonate, how do you bridge those? And the baby needs to, the baby already has come. You have to make decisions really fast. Stakeholder labda kwa Busia, one of the big stakeholders. What do you do about it? Are you thinking about it? Do you care that this process matters? This is where we're talking about ethics. And something I threw in there for the works, number 8. What if in the analysis of this milk, in the lab we find something else? Remember we said it's a biological material from the body of this mom. Do we feel obliged to share these findings with this mom or with her provider if this information may be useful in her care now or in future? Those are things to think about. All right? So let's see the stories from our media. Do you remember this? The protesting moms made a point of breastfeeding their babies outside parliament recently in Kenya. Remember 2018? What was the story behind this? Their march was precipitated by a restaurant's refusal to allow a mom to breastfeed at one of their tables, directing her instead to the lavatory, which the environment was not sanitary. When was the last time you saw a mom breastfeeding in a hotel setting? What about this conference? Now we go look around. Did anybody come with baby? They came with baby? Does the conference make arrangements to ensure a nursing mother and her baby can be comfortable? They do? I will look around when I step out. That one. This is where we go. This is the slide I had about that. Consciously, intentionally making sure when you're recruiting students, when you're recruiting employees, if she's a nursing mom, the concept of justice prevails. The principle of justice is applied. I'll give an example of the PhD program called CATA. How many have heard of CATA? It's a PhD program that encourages training of faculty in the universities in Africa. We have about 4 countries on board in Africa, and they encourage women to stay, to reduce attrition. They pay for the ayah, for the babysitter. And you know the training happens, like most often we do it in Makerere for a month. They pay for the ayah to come with you and the baby for a month. I'm not kidding. I'm a facilitator. I volunteer for, because I really believe in that program and I love it. So a lot of women, if you see pictures of CATA graduates, in fact now if you check online and all, you will see people graduate. Some of them would be holding the baby and they show this baby was this way when I was writing the proposal. This baby has reached here, I've come to defend. They are still carrying the baby. No, that time you leave them with the other stakeholders. But they allow for space for breast. So this is something to consciously think about. This was an example I saw recently being posted for Bungoma, Kakamega, female, entrepreneurs. And I saw that they said, oh, they have a baby. What did they say? They will take care of that. Arrangements to be provided and nanny services for women with small children, 6 months to 3 years. We want to see more of this. This is what we are saying in programming. But we are also saying that women, we and our stakeholders need to stand up and fill the gap in the policies that are there to guide us in our nation on breastfeeding issues and breast milk use, isn't it? So allow me, my time is almost up. So when you think about also adolescents, I had to put this one here. Again, we think of the Kenyan context. By the way, I'm Masai. Kwetu, by the time you are 14, 15, you know. And I think elsewhere, many of the mothers, our context, it's clear, many of our mothers are below 18. And they are learning to breastfeed, some of them for the first time, and struggling with it. So what are we saying? How do you reach that adolescent for your research? How do you engage them in your programming How do you ensure ethics are followed? How do you take care of all the stakeholders, including consent and assent, when you're dealing with them? What about breastfeeding in the school setup? Because some of them say, oh, once you get the baby, just come back. You're almost sitting your exams. Do we make arrangements, programming within the schools? And I saw there was a task force that was saying, hey, can we do something about some type of crochet, if I may just use that word, in the school setup, so that girls who have very young babies, actually the stigma drops, or somehow, there's stigma to deal with and all the other things. But the idea is, can she breastfeed if she wants? These are things to think about. So when you think about the milk banks, this was 2017 when we started the first one in Pumwani. I found, oh, she's raising, tell us, were you involved? You were the one. Let's clap for her. Oh, this is nice. So Kenya launches the first breast milk plant to help newborns. I love it. Of course, I saw some comments in the media. Maswaya nani, whose milk for my baby? I don't know it's coming. Witchcraft, fears, all kinds of beliefs and cultural norms. That's why I put there question marks. You have to think about all those things and think about what's best for who? The baby and the mom, and the best way forward. So, thank you. When you think about milk banks, we think of respect for persons, we think of beneficence, and we think about justice. When you think about respect for persons, what comes to mind? You have to think about is there a compensation? Are you paying the donor? And is the recipient paying a fee? How is this fee going to be applied? I know she's doing this, so everything is free for now. But we need to think, what if this becomes commercialized? And more people need that. But for now, it's free, At the end, Okay, how much would be paid for the breast milk? Would that lead to undue influence? That is an ethical concern also, if we're to go that. What are their rights and IP? Later on, after the milk is used for something that brings all kinds of knowledge, Then we ask about consent and use. Is it clear to the mom, after you've given me the milk, this is where, don't follow me again about how I'm using the milk. Those things about where does the consent and reconsenting stop or finish, okay? And then there's a right of the donor to receive safe quality milk. So that needs to be taken care of. And then there's that issue I raised of pasteurization vis-a-vis sterilization, which bridges us to beneficence. If we process it so much until it's not as nutritious as mother's milk should have been, why bother with all these steps? These are things to come up. Is it what is best in the best interest of the child? Have the healthcare providers fully informed the mother or the stakeholders on the benefits of doing this? And what about shelf life? Those things need to be considered. And the last point on justice, equitable distribution, like we said. Can every infant, beginning with a preterm, because now you start having levels of vulnerability again, are we being equitable in the distribution and availability of this? And things like that. So I saw that the Government Act of 2017 includes workplace crochet and spaces to express and store your milk while you're at work. So you may want to look that up when you're thinking about breast milk, and think of research that we can do to advance these policies to another level. And so as I summarize the ethical considerations, all the vulnerable populations you listed for me, most of them this list will apply. So as you think of the nursing mother, you need to look at the consent. We've talked about that. Number 2, are you qualified to do this research? The suitability of the PI is very important in ethics. You're dealing with a vulnerable population, we've agreed that. Do they have a right to withdraw? Does it take away any standard care or any benefits? What are the implications for that? And is there psychosocial support? We've seen that in breast milk issues, these moms and their spouses may need a lot of that. Are there plans to give them any product that may come out of this work? Let's say if it's in research and the milk, you proceed and get something that is useful. Will you come back to Kilifi and share with us what you got? All right? Compensation, and we talked about financial costs and any rewards. I think this one I've already alluded to. Community considerations add to it when you're talking about the breast milk, apart from the respect for persons, beneficence, non-maleficence, and justice. Remember everybody, from the grandma and even what you leave behind with your research. If there was no capacity for managing breast milk, build that capacity. I hope in Pumwani that is happening. Oh, she's shaking her head. Excellent. That's what we're saying. What is the issue? What is the solution? So what? So what is about the significance of the work? If it's significant, leave something behind for the community. So those are community considerations. Community are going beyond the health facility and thinking about the broader stakeholders. So as I finish, I like this quote by Kamas that says, "A man without ethics is a wild beast loosed upon this world." I ask that you go out there as a pediatrician. Remember that slide on morality and being ethical. A person of integrity. Write an award-winning proposal with the best design you could think of. Think of all the blab on knowledge and the dot you're going to add, and think about the ethics that go with that. Think more so about the vulnerable. And in this case, we are thinking of the nursing mother and that infant. How can you make it better? How can you make that programming better and more ethical? How can you make the experience of this nursing mother better through your research? Thank you.
Thank you very much. And I'm glad that we have had that session, which was very stimulating. I thank you very much, Prof. I think after having listened to you and coming after you, I would like to tell you a story. Many years ago, we had a very eloquent politician in Kenya called Joseph Tom Mboya. And he was very intelligent. He was a very good speaker, very good public speaker. And it was said that if you were scheduled to speak on the same platform with him, it was very difficult to decide whether to come before him or after him. Because if he came before you, once you started to speak, everybody would just say this. There is no need to go further because you cannot compare. And if he came after you, then people would forget what you had said because they can only remember what he said. So it was always a dilemma. And I find myself in that dilemma now, coming after Prof with that very excellent presentation of research ethics, really an overview, and it was excellent. And fortunately, I'm not addressing the same subject. I'm talking about conflict of interest in research and interventions in breastfeeding. Now, why conflict of interest? It follows because of what Prof has said, in that we are dealing with a vulnerable population. We talked about 3 parties or 4 parties that were vulnerable. We talked about the mother, the infant, the other stakeholder, the father of the child. We even talked about others, but we talked about the breast milk as a biological substance or a product in itself. So when you are dealing with a vulnerable population or others, you have to think about conflicts of interest, because as a researcher, and particularly as a doctor and a pediatrician, you have fiduciary responsibility to certain persons. As a doctor, you have fiduciary responsibility to your patients. You are the one who is standing between the pharmaceutical companies that want to sell their product and the patient who is using that product. The pharmaceutical companies and other companies that sell their product, including instruments, have profit motives, and therefore they would like to have as much as possible into your patient, and you're standing between. So you have that responsibility to ensure that these people are not exploited, the vulnerable are not exploited. On the other hand, you have a responsibility that your vulnerable population have the best use of the products that are available in the market. And in terms of breastfeeding, in research and also in programming, the researcher or the doctor, if in case of programming, or the nurse or the others who are doing the programs, have this fiduciary responsibility in that you are in between the vulnerable and other interests. Now, a conflict of interest. I would like to ask you, how many of you have more than one interest in terms of your vocation, in terms of your work? Okay, yeah, we have a hands up there from Catherine. Yes, what interests do you have? What are your various interests?
In my place of work, number one, I'm a pediatrician.
You're a pediatrician employed by the county government?
The county government of Nairobi.
Yes.
Number two, I have to profiteer the hospital.
Yes.
And
okay.
number three, I still have to profiteer myself. That makes sense. And I have a private practice as well.
Yes.
So when you're seated at that office, you have conflicts in when I'm making my decision. I have to consider there's a wing that has to run, let's say the physiotherapy team needs some money, but there's also these neonates who are my love, who also need some money. So it's really very conflicting because you will find I will nitaegemea upande moja more than the other. That makes sense.
Thank you very much. So she said that she an employee of the county government, responsible for the hospital with various departments, and she also is involved in a practice where she earns money. Anybody else who can give us who has more than one interest in their vocation, in their work, related to work? Okay, let me ask, how many of you have a private practice? You're involved in private practice, but you're employed elsewhere. How many of you do locums? You're employed somewhere and you do locums in another practice. Okay, we have that example. How many of you have families? And you work as well, all right? And how many of you, apart from your employment, you have a side hustle? You know, we are a hustler nation. Okay. Prof, what's your hustle? All right. She keeps pigs. Wow. I thought you were going to say you do consultancies. You do that too. All right. So there can be multiple interests. Yes. So when you have multiple interests, there would be one that you identify as a primary interest and others as secondary interests. So let's start with Catherine, who had given us an example. Among us, those interests in terms of work, which is your primary interest? Which one would you identify as your primary interest?
The hospital.
The hospital, the employment with the county government in the hospital. And many of us have multiple interests in work. And you'll find that there is one of those that is the primary interest, that if you look at, it is the one thing that you are required to do primarily, or you started with, and which is supposed to occupy you most of the time, but others are add-ons or additional interests. So it is where there are multiple interests, there usually is one interest which is primary, or that you can have a hierarchy of them, that this is the most important, these two are least important. Now, what difficulties do you experience, because we have examples here of people with multiple interests? What difficulties do you experience because of having multiple interests. Any volunteer? Yes, those who are involved in private practice, part-time private practice, as well as their employment. What difficulties do you? All right, we have somebody volunteering.
Hello. Is it on? Sorry, I do not have maybe private practice, but with the example of having a family and having to be in school, the issue is always timeshare. So I feel like I'm not giving my family any time, and then I give school most of my time, and it ends up hurting my social life. Also, I'm looking for maybe locums to earn some money. So I'm always conflicted or pulled to one side, and I feel overwhelmed most of the time or strained most of the time.
Okay, thank you. And I see she has introduced a word there, conflicted. You feel conflicted. You find that some are coming into conflict, either, and that she has also mentioned that one of the interests seems to suffer because of having multiple interests. And then what then are you required to do to continue? Okay, how do you manage those different interests?
I answer again?
Yes.
So I'm forced to choose priority.
Yeah.
I have to choose. Today, this is what I'm going to give priority to. Otherwise, I will collapse.
Okay, thank you. Yes, what she has said is very important. You manage it. You decide priorities. You think about it and say, I'll give priority to this and that and that. So thank you very much. So the multiple conflicts, interests, because they result in conflict, need to be managed. And if you don't manage them well, that is then when we have problems. Okay, let's go. Now, I would like to just read a scenario here, which relates to a research or a researcher, so that as we go along, I may use it as an example of the various points that we want to learn today. And so I would like to read it, or perhaps it's on the screen, so I would like one of us to read it. Dr. Washeke, your eyes are good enough. Could you read it for me? And there is a correction which I will, on paragraph 3, where it's, okay, I will, when it comes to, I'll correct it. Yes, go ahead and read.
So, a professor of neonatology in a high-ranking university hospital. She's involved in teaching medical students, caring for newborn babies, and doing research. She carried out research on the benefits of breast milk for preterm infants of HIV-infected mothers. She published her results in a high-impact journal. She was later appointed as a director of a formula milk manufacturing company with very good emoluments and benefits, including dividends from profits the company made. The formula milk manufacturing company sponsored a symposium on infant nutrition and requested the professor, in her capacity as a thought leader, to present a paper on the benefits of micronutrients added to breast milk formulas.
To breast milk, not formula.
Or added to breast milk.
Yeah.
Most of the contents of the paper were prepared by technical experts of the formula milk company. On reading the paper, she found that it stated that micronutrients added to breast milk had marked benefits for premature babies. However, there was no data to support this fact. She was later awarded a grant by the same company to research to investigate the benefits of preterm infants of formula milk fortified with probiotics.
Yes, so so we have a situation here where we have a highly accomplished professor of neonatology, And she's well accomplished. She has published in high impact journals. She has responsibilities of teaching medical students, caring for newborn babies, and doing research. And but she's also offered a position now in a formula milk manufacturing company. So that becomes other interest now. And when you're a director, you participate in making very significant decisions in a company. And then she's been there is a symposium which has been a symposium on infant nutrition, but it is sponsored by the Formula Milk Company, of which she is a director. And she's been asked to read a paper, but it is very it's technical, and it was prepared by the technical department. The problem is that after she has read it, she has found that some of the facts in that particular paper that she has to read as a thought leader, which means that she will be seen by the audience as somebody who is more knowledgeable, and therefore a leader in that particular respect. She finds that some of the facts in that paper are not supported by evidence, according to her knowledge. She also, that is one scenario. The second scenario is that she's given a grant by the company for which she is a director to investigate the benefits of preterm infants of formula milk fortified with probiotics. Remember she has published a paper on the benefits of breast milk to preterm infants. This is just a scenario. And it indicates that this particular, you'll tell me about that. So as a professor of pediatrics, this particular professor of pediatrics, what is the primary interest? What is her primary interest as a vocation? Okay, the question is to the audience. From the scenario that we had, what is the primary interest of this professor? Yes?
I think our primary interest is being a lecturer or a professor in the university. Because I think the directorship, she was just appointed. She didn't look for it.
Yes.
Or even if it came secondary to that. So I think her primary is being a professor in the university.
Thank you. Anybody else who sees a different primary interest, or who has another explanation? Okay, Dr. Shiroya. Okay. Okay, thank you. She's a teacher, she's a clinician, and she's a researcher. And that is, as a professor of neonatology, that's her primary interest, and those are the activities that she's her primary interest.
Stephen, it was another comment.
Yes, another comment. Thank you.
Ah, okay, same comment.
It was the same comment. Okay, thank you. Now, we have the professor was in the research that she's to undertake, which is the grant that she has been given to undertake the research. Does it bring any conflict with her primary interest? She's to undertake research on the benefits to preterm infants, okay, of formula milk fortified with probiotics. Is there any conflict in terms of what the research that she's to undertake? Yeah.
Okay, our first publication is on the benefit of breast milk to preterms. Then she later joins this company as a director for formula milk. And for those who know,
formula and breast milk. There is even a law that regulates how you market, how you even interact with the manufacturers, the promoters, and those that are marketing formula milk. So the second position, and the formula milk manufacturing company sponsored us on infant nutrition and requesting the professor on our capacities other thought leader to present a paper on the benefits of micronutrients added to breast milk formulas. So that is a designated product. Yeah. Of course, the formulas, because one, the breast milk alone is, you are talking about the benefits of breast milk, but here now you are coming and you're talking about how other things, that breast milk is not adequate. It's contradicting. There is conflict of interest in the first publication that is already out, and now you are talking about other micronutrients, that now you are adding other things to supplement the breast milk which you published and you talked about its benefits. There is a lot of contradiction.
Okay, thank you. And we find that yes, the question there is that will her directorship in that company, because the company would like to make profit, would her directorship in that company interfere with her the judgment, some of the decisions? Will it bring bias in the research that she's doing? Will it bring bias? That is the concept of conflict of interest. That your other interest may bring in may put you at risk of bringing in bias in the way you do the research, in order to because of your relationship to, for example, to the other company, to the other interest, because of financial interest, because of other interests. But let us continue. We say that a conflict of interest is a situation where two or more competing interests create the perception or the reality of an increased risk of bias or poor judgment. That is, your interest, your secondary interest create, as I say, a perception. It may not be real, but there is a perception that it may cause a bias in your judgment when you are doing research. So in this case, we haven't, the professor may be a person of integrity, and whatever her interests are, it may not interfere with her judgment. But the story alone, the situation, the circumstances, if you look at it, and that's what we were looking at, you look and say, will this person really not make her results want to please the company? Being a director in that company, being a beneficiary in that company, will that not interfere with it? It may be a perception, or it may be a reality. And we say that we encounter these conflicts in many situations. And as our sister here had said, the important thing is that you need to learn to manage those conflicts so that they do not cause harm to one of your interests or to other parties. So as we said, that the perception, the conflict of interest, the risk may be a perception, or it may be a reality. It may be actual, or it may be potential. Now, in the context of research, we say a conflict of interest is a set of circumstances of conditions in which professional judgment of a primary interest, such as integrity and quality of research, tends to be unduly influenced by a secondary interest. That is in the context of research, that you are saying that this situation may unduly influence your judgment in another situation. And why is conflict of interest important? It is important because it brings in a risk that it can result in consequences that are damaging to the intentional or even to intentional misconduct. These can drive you to intentionally do research misconduct. But it is also that subconsciously or unintentionally, it may drive you to make decisions which you would otherwise not make because of your other interests. And as we had said before, as professionals, as scientists, you have a professional responsibility, a fiduciary responsibility, and an ethical responsibility to that your research be conducted in a proper way, and that the research be conducted in a particular way, so that the results of your research, the decisions that come from the results of your result, are truly are backed by fact, are backed by evidence, and do not mislead. Remember, as Professor had said, that you're adding a dot, you're bringing in knowledge, you're going to affect, your research should inform policy or practice. And if it is, if your decisions have been biased because of other interests, there is potential for harm. We say that the conflicts of interest increase the temptation for research misconduct, and research misconduct is a very important subject, but many of them may be unintentional, and most of us do not appreciate the risk, the high risk of bias because of our secondary interests. We have mentioned that. I would just like to say, what are the drivers of the conflicts of interest? The drivers are mainly, one is financial gain. Our professor here is a director, has been appointed as a director, and we said there are significant emoluments, there are dividends to be gained. It is financial, and that is one of the biggest drivers for conflicts of interest. That you are in a position where you benefit financially, and that may be a big driver. But there are others, like career advancement. You're an upcoming person in the university or in the hospital, you need to publish, and that can also drive people to be involved in other conflicts of interest. And you also may need to, and if you publish, you may become famous, you may become powerful. There is also conflicts of interest. It is not only you who may benefit from that, your friends and family may benefit from some of the interests that you may have. So a conflict of interest involves not only those interests that may benefit you that are secondary, but even if the beneficiaries are your family or your friends, it may help. But what in the research process, I would like to say, and Professor and Caroline mentioned this, that the research process itself tries to mitigate the effects of the negative effects of conflicts of interest. And some of these are the factor are the objectivity in research, the blinding sometimes which we have in trials and other experiments, the repetition of studies. That is when you have done a study and your data is shared and people repeat that study, they're supposed to, that helps for us to mitigate some of these studies. Peer review is another scientific process which helps us to be protected from issues of conflict of interest, disclosure and data sharing. And so we need to see how to manage conflicts of interest. And this is mainly to comply with regulations. This may be institutional, and they may be also legal or government regulations, but institutions have. And professional organizations like the Kenya Peadiatric Association, I hope they will move into this, as well as institutions and journals have guidelines on how to mitigate or how to prevent or how to manage conflicts of interest. And one of them is really avoiding or minimizing conflict. One of the things is that if you know that you are conflicted, the situation that is conflicted, you remove yourself from that particular research so that you do not participate. But if you are not able to remove yourself, then you can use the research process to mitigate that effect. And an important aspect of managing conflict of interest is disclosure. And as all of you know, and we did not go through that practice, is that when you're making a presentation in a scientific conference or others, it is good that you declare if you have any conflicts of interest. And also in publishable journals, they also require now that you declare your areas of conflicts of interest or other interests so that people can make judgment. So if I'm published a paper and I was sponsored by this group, that you can judge and say that this interest in this on the people who have sponsored you, if they may have brought in a bias in the judgments that you have made. And we say that on the other hand, managing potential conflicts, that's where we say that you try and remove yourself or in your research team that you select people who are not conflicted to be responsible for the various aspects of the data of the research process. So just to conclude this short presentation, we would say that we often find ourselves in situations where two or more competing interests create the perception, and that perception is very important, or the reality of an increased risk of bias or poor judgment. So you yourself as a researcher may know that this has not affected me, but what will others think? If my colleague, Professor Naanyu, has produced a paper, but you know that she has earned, that her sponsor heavily subsidized or heavily paid her, you need to know that, okay? You need to know that so that when you read her conclusions in her paper, you can reflect and say, is there any bias that may have been brought with that? If our professor in this particular story publishes that paper and says that the probiotics added to formula milk make it superior to breast milk, yes? Would you, we need that declaration to that for us to think, but she works for that company. Could that have biased her? So declaration is important, okay? So conflict in the profession of science are not inherently bad. These conflicts will come because we are, when you are a researcher, you most inevitably will be involved in multiple interests. It is how we manage them, how they are handled, that can lead to untoward, inappropriate, or bad outcomes. And it is important for us to keep learning because the situations keep changing and our relationships with our interests keep expanding, and even our relationship with other companies keep expanding. Many of us, many researchers have complex relationship with different organizations. And if I was to ask Professor Naanyu here to narrate how many organizations she's involved with, academic, non-academic, some of them in fact commercial institutions, there are so many. And it is the guidelines, it is knowing how to manage our conflicts of interest, but also being aware that these conflicts of interest can bring bias in our research. Thank you.
Well, thanks so much for the opportunity to address you today. And let me say, I would have very much liked to be with you physically in Mombasa. And just hearing in the morning the engaging talks of the two previous speakers and listening in on the interaction with the audience, I thought this would have been fun. But unfortunately, it's term time, it's our spring term at the University of Zurich. I have lots of teaching and other stuff, so traveling to Kenya just unfortunately wasn't an option for me. So I'm glad to have the opportunity to be engaging with you this way. Let me just say maybe a few words about myself. I'm a physician by training, but I specialized after my medical studies in medical ethics. And I've been doing teaching and research at the Institute of Biomedical Ethics and History of Medicine of the University of Zurich since 2005. And our institute is also a WHO collaborating center. So I'm also frequently in touch with colleagues around the globe, and we discuss these intricate and fascinating ethical issues from many different perspectives. And maybe just a final comment. I think the focus of the workshop has been very well chosen. I can illustrate this with a personal anecdote. When I was a young professor and I had my first child, I really had no real role model of how do I manage. I mean, I came from maternity leave and now I had this child that I breastfed. So how do I do this in a day full of meetings? You have teaching, you have stuff. So I just, in the meeting, I just brought my daughter and I just breastfed her. And I got some frowning. I got some people who thought this was inappropriate, whatever, but I was young and I didn't care. But I think we really should make it easy for women to breastfeed, no matter what their circumstances are, no matter what their professional context or their other, obligations are. So I think this is really an important issue that we are addressing here together. So thanks for being here and thanks for your interest. I think we can now get to the slides. So what I want to do is really introduce what we call EFBRI. That's the Evolving Ethical Framework Informing Breastfeeding Research and Interventions. It's really an ethics framework informing both research and interventions. I want to then show how we can use EFBRI by invoking a few case studies. You've already done this in the morning by discussing a case study with a view to conflicts of interest and also with a view to research ethics more generally. And I think this will also prepare us well for the exercise later on, where you will actually be discussing cases and then reporting back to the audience on your finding. And you may find EFBRI to be a useful resource that might guide your discussions in a certain way. And this is why we've also handed out this one-pager to you that just summarizes the principles that we've put together in EFBRI for you. I will then proceed to give you a little glimpse of the work we are undertaking right now. And this is really working on the second part of EFBRI and on a specific toolkit. I'll say more about this later, and we'll come to some next steps and an outlook towards the end. Right? I think we can have the next slide. Now, introducing the subject really. You've already heard about the ethical principles of research, and we have, on the one hand, we have researchers, on the other hand, we have participants, and there are certain general principles that are important, and I'm sure that we all concur are important. As far as participants are concerned, we want to heed their autonomy, we want to do well, we want to avoid harm, we want to be just and fair, we want to respect the dignity, we want to also respect their privacy and treat their data confidentially. And as far as researchers are concerned, they should be competent. We want to have researchers that excel in integrity, that are responsible and honest. So this seems to be the easy part, so to speak. But as the Council of International Organizations of Medical Sciences, short CIOMS, has said, the key challenge of doing this at an international scale is really that we need to apply those universal ethical principles to biomedical research in a multicultural world with a multiplicity of healthcare systems and a considerable variation in standards of healthcare. So we do need global standards, but at the same time, we know that context matters in application. It matters significantly so. So I would dare to say that there is no one in the world who can write something like the Holy Book on Research Ethics, right, from an office desk that would answer all questions that might arise in very concrete, studies. But what we need is really a constant dialogue and exchange with practitioners and academics between different regions or even cultures within regions that help us tease out, where we might differ, for what reason we differ, and what the area of consensus currently is. And this is also, of course, something that's an ongoing challenge. And this is also, these standards might evolve, might be dynamic. So this is no business will ever be done with, right? But we need to constantly kind of come back to this and make sure we understand our ethical positions and the reasons and arguments we have to support them. Next slide, please. International research ethics, of course, is important. It's been done a lot over the past few decades, right? But an area that has tended to be, not treated so much is really research ethics in breastfeeding. We know a lot of research is going on in this area, but still there is fairly little specific guidance. We have those very general principles, but what we are lacking really is something that's maybe a little more specific, yet still comprehensive for those studies that are going on in this particular field. And what makes this area so important is that, of course, and you've heard this in the morning, right? We are trying in our research to generate helpful knowledge, but at the same time to protect mothers and their infants while aiming to advance the health and well-being in vulnerable situations, and while respecting and possibly even enhancing women's autonomy. So we want to achieve a lot of things at the same time, and we have to make sure we don't pursue one goal at the expense of the other goals. And just a word on vulnerability. You've heard before, we wouldn't say that women, as soon as they are pregnant or breastfeeding, are vulnerable in themselves simply because they are pregnant or breastfeeding. But there are many specific circumstances that may mean they require special protection given those circumstances. I think there are different potential reasons for being vulnerable. There is the physical conditions. You can't move as quickly, right? You may get exhausted more quickly. There are emotional issues. There are social issues. We know that many pregnant women will do a lot of things if their fetus can be rescued, if they can secure they have a healthy child. So there are different reasons that may...
Recording in progress.
That pregnant and breastfeeding women are in need of special protection without undermining or questioning their autonomy. And then another issue that makes this area so important is, of course, it also involves embryos, fetuses, or embryonic stem cells. And we know, of course, from the bioethical discussions that these are very touchy and highly emotional issues. What may be done in research with human embryos, for instance, is highly contested. So a lot of sensitivity is needed to cover this area well. And then a third reason is really that currently we have fairly little guidance that informs biomedical research in breastfeeding and lactation. A notable exception is the CIOMS guideline. You may remember I just quoted CIOMS, the Council of International Organizations of Medical Sciences. You can find this reference easily on the internet. And this specifies what the special obligation towards pregnant and breastfeeding women as research participants. It talks about the need for consent, the permissibility of risks, etc. But it's really only a guideline about these specific issues. But what's really lacking is, or what has been lacking is a framework that brings together those general concerns informing research and also these specific concerns for research that's being done around breastfeeding and lactation. And this is the gap we were hoping to address with the EFBRI framework. Next slide, please. Now, you will find EFBRI documented on www.lactaethics.org. So if you have a phone, feel free to just check it out. You have the summary as a paper version, but you also have the entire statement online. So we really are using this as, and you see it's an evolving framework. So we've done our best to compile what we think is important, but this is kind of the beginning of a dialogue, and we're very interested in your feedback. You'll find an email address on this website. If there's anything you would like us to take into consideration, please feel free and let us know. And this is also why we appreciate the opportunity of this workshop, because for us it's a wonderful opportunity to see what issues you consider in discussing the cases later on of interest, and how we might want to enrich our framework in the future. Next slide, please. So what is special about EFBRI? It's an open access compilation of ethical principles to guide research on breastfeeding and lactation specifically. It's based on a review of the relevant Swiss national and international laws and guidelines, and it's not because we think Swiss laws are the best of the world, but it's because the Larsen-Rosenquist Foundation that initiated this work is based in Switzerland, which is why we, made sure we covered, let's say, the family Larsen-Rosenquist Foundation's home base, and made sure, we took the Swiss legal situation on board. What this framework is also aiming at is really bridging research and practice. And you'll see we have a first part that's already fleshed out on classical research, clinical trials, etc. But we are also aiming at a second part that really deals with interventions once they are established. And then something you may have noticed that we call this not only an ethical framework, but an evolving framework. And very much so because we consider this a learning document that depends on feedback from the research community for the reasons I've just detailed, and that assesses the need for clarification and more detail. And it's also what we are working at is an interactive format that will make it easily searchable. Right now, what you'll find is a PDF on the website, but we hope to be doing some more innovative stuff in the future. And then it really is a modular system where you can then find biomedical research and other areas covered as well. Next slide, please. So for whom is EFBRI really? It's a globally applicable ethics framework with a specific focus on research with breastfeeding mothers and children. And it aims to support a diverse range of stakeholders, such as researchers, people who are reviewing research, healthcare practitioners, study participants, healthcare policymakers and planners, implementation specialists, educators, and funders. So really a rather broad range. And what we also think is that current guidance really needs to reflect the dynamic nature of biomedical research and the involving global consensus. And we think that by having this kind of shaping this community on the net that will provide constant feedback, we can have this kind of, I think, quite forward-looking tool that informs research at a sufficient level of detail. Next slide, please. So, of course, we haven't created the normative basis of EFBRI. We would be in no position to tell the world how research in this area should be done, but we have built this based on existing laws, conventions, declarations, and guidelines that are relevant to the area. There are 2 Swiss laws that are relevant, the law on research involving human beings and on research involving embryonic stem cells. We have also looked at the Convention for the Protection of Human Rights and Dignity of the Human Being with regard to the application of biology and medicine of the Council of Europe, a very complicated title, which is why it's mainly referred to as the Oviedo Convention. We have, of course, based this on the Declaration of Helsinki. This may be what would have come to your minds first, right? This is a very important key reference in research ethics, and also on the CIOMS guidelines that I've already mentioned, and on the Universal Declaration of Human Rights. So this has been our basis. Next slide, please. So what did we do then? So we looked at the fundamental principles that were elaborated in these laws and guidelines, and we compared them and saw, where they overlapped, Fortunately, there was no explicit conflict between those documents, so we could just ensure we cover the ground. What we then did is we did a review of the breadth of human milk-related research, and that includes very diverse studies. It could be on the physiology of breastfeeding, infant nutrition, gene-nutrient interactions, the effect of hormones, models of metabolic functions, and then also something like outcomes of changes in diet, infant or maternal health issues, impediments to breastfeeding, social and economic implications. So we really looked at what different studies are out there in the field to ensure that the scope and the content of the framework would be relevant to research broadly focused on breastfeeding and lactation. And then, as a third step, this document was reviewed and revised together with a technical advisory board with legal as well as medical and clinical research expertise. We don't consider this finished at this point. We have a version, and we are always willing to reconsider, to improve and enrich. Next slide, please. Now, this is what you may have in your hands. I'm not in the room, I can't see this, but I think this overview has been made available to you. And you've heard many of these issues already invoked in the talks by Dr. Violet, by Dr. Stephen Muhudhia. So this is an attempt to just provide an overview and assemble those important concepts on a sheet of paper. And I'm not going to walk through the framework in detail. We'll be sitting here this evening, and I think that's not a way to actually be doing this, but we thought it would be more informative if I provide something like a few glimpses and you then discuss in small groups cases and see if the framework might be useful. So let's just see what's on this slide actually. So the first issue is really the purpose of research and scientific relevance. This is just the simple fact that research, of course, needs to address a gap in existing scientific knowledge with respect to breastfeeding and lactation. It may really involve humans only if it addresses a topic of scientific relevance. So, if you are doing research that's actually redundant or nonsensical, you're already in conflict with the first principle. And then we'll get to number two in a second, so I'm not going to detail anything say anything on that one. But regarding research infrastructure, for instance, the principles or the framework stipulates that the research team needs to be appropriately qualified with regards to its ethics and scientific background. And if you do medically related research on patients or on healthy volunteers, you need the supervision of a competent and appropriately qualified physician, a healthcare professional. So you see, there are some very basic requirements that we have, by the way, also translated into a checklist that you will find at the end of the entire EFBRI document, if you care to look at it on the internet. And then, of course, you need to have a research protocol. You need to have a review by an ethics committee. You also heard about this from Violet earlier in the morning, and I've heard that the Kenyan ethics review committee system is developing very nicely. So more and more highly qualified ethics committees are available for such review. So these are kind of the very basic requirements, right? And then you see number 6 on the top of the column in the middle, and that's another key aspect, of course, that is consent. And the guidelines here say that consent must be specific, expressly given, and documented, and you have to make clear that this consent can be freely withdrawn at any time without having to state any reason. So that's an example for a universally acknowledged rule, right? That's something that we think, you've heard about the abuse in Nazi Germany, right? So this is something that we think is key. People need to, participate freely, and if they want to withdraw, they have the right to withdraw without, getting negative consequences on this. And then this number 6, I'm just giving you a few hints at what's behind those numbers, really, right? This then continues on to say that consent must be in writing,
And now things get interesting, right? Is this realistic under all circumstances? So the guidelines say here, in the event of an exemption, in accordance with national laws, the non-written consent must be formally documented and witnessed. So, there is some recognition that under certain circumstances, exceptions might be advisable, and we'll see one of those in an example later on. But it needs to be in accordance with national laws, and there needs to be certain minimum standards for claiming this exception. And then the number 6 goes on to then say, well, if we have consent, what is important that no one else may step in, and that's a particular concern that if you have a woman in labor, a woman who's just given birth, someone else will sign because this woman is not available or busy or whatever, and the guidelines are very clear in saying that no one else may replace the breastfeeding woman's consent unless she delegates this right unless she's not able to make decisions and she has a legal representative, which would be special cases that need to be considered very carefully. And then this number 6, which is a very important component of the entire framework, also says, well, if we ask for consent, what does this consent need to contain? Needs to include the nature, purpose, and duration of the research projects, the foreseeable risks and burdens, the expected benefits for the research participants or for other people, the measures taken to protect the personal data collected, and the rights and safeguards prescribed by law for their protection. So this is something that is, on the one hand, fairly generic, but on the other hand, of course, it needs to be heeded in breastfeeding research as well. And then we come to another point, the number 7, additional requirements for research involving vulnerable groups of particular importance for this area, which is why this is also quite detailed and come to this in a second. And then we have specific cases, the use of biological material, the use of embryos or embryonic stem cells for research, use of placebo, research in emergency situations. So these are particular constellations. And then finally, 2 chapters on data protection and the right of participants to their own data. Now let's just have, let's take a few specific glimpses at the framework, as we can't be comprehensive here. On the next slide, you see, how, for instance, the principle on human research, how this will look like. Under this principle, you'll find 5 points that says something about how you need to conduct research on human participants, how you select participants, how you need to already try to predict as far as possible the risks, burdens, and benefits, how you can minimize risks, and it says something about incentives for participation. And each of these then again has subchapters that deal with specific aspects. For instance, for the first point, conducting research on human participants, it will say, well, it will cover the following points. Has consent been appropriately obtained in writing? Are there no alternatives of comparable effectiveness to research on humans? Are the risks incurred by participants not disproportionate to the benefit of research? Does it comply with regulations surrounding scientific integrity? For instance, how you manage conflicts of interest. Think back of the last lecture you heard just before the break. And are scientific quality requirements met? So we are trying to really get specific here, because if you just have this very general kind of list of principles, it's not going to get you very far. But once you delve deeper, you will go from layer to layer and really get to the very specific questions that you need to deal with research proposals, or when you're involved in doing research with the implementation of research projects. Now on the next slide, another just glimpse at the guidelines. This is now number 7, which are already flagged, saying, of course, vulnerable groups or people in vulnerable situations are an important concern in our specific area of breastfeeding research and lactation research. So this chapter answers questions such as, when can research involving vulnerable populations be justified? Because of course we would not want to exclude people who are at increased risk of harms from research, right? It would be a pity if we did not gain more knowledge about women who are breastfeeding. So we need to define under which conditions such people can actually contribute. And if you now read up on the guidelines, if you now looked at them in more detail, you would find there are 5 basic requirements. And you might find this useful, for instance, when you're discussing your cases. They are, you may do research involving vulnerable individuals if the research is responsive to the health needs or the priorities of this very group. If the group benefits, if this specific group benefits from the knowledge, practices, and interventions that result from the research, so there needs to be a group benefit. If equivalent findings cannot be obtained by other means. If, fourthly, the risks are minimized and are outweighed by the prospect of potential individual benefit. And if specific protections are taken, allowing no more than minimal risks for procedures that offer no expected direct benefits. Of course, you won't be able to memorize all of this right now. I'm just trying to tell you what the content is. And if you work more closely with the EFBRI, you will then see, oh, if I do research involving vulnerable populations, there are my 5 basic requirements, for instance. And then, you under this chapter, you also find some more stipulations regarding if the vulnerable populations include specifically women of childbearing potential or pregnant and breastfeeding women or minors. All of this is frequently the case when you're doing research in this area, right? And you'll find details of the information that's required to study participants about the potential risk to the fetus, for instance, the need for providing access to follow-up of the future child, or the role of legal representatives in the case of minors. Or you could also then answer questions then such as, when can you carry out a research project with an expected direct benefit on adults who lack capacity? So you see there are quite to the point questions that the framework is specific enough to answer. Next slide, please. And there are also specific constellations such as under what circumstances can we use placebo in research that are detailed in the framework. Again, I'm not going to go into too much detail in the interest of time, but what is important is that, the benefit, risks, burden, and effectiveness of a new interventions must typically be tested against the best proven interventions, right? Usually we'll test something new against the current gold standards, but we may depart from that if no proven intervention exists or if no standard treatment is available. And there may also be some other compelling, and scientifically sound methodological reasons under which we may be able to use placebo, but then the additional risks of serious or irreversible harm as a result of having chosen the placebo may not exceed the benefit that's expected. So again, not going into the details of this, maybe some of these issues come up in your case studies, but what I'd now like to do really is give you a few pointers as to how this can actually be used in concrete cases. And you see on the next slide, you see a first case study here. And so this, and now I'll again just be very brief, this is a randomized controlled trial that was done in Australia, and that was used for determining the effects of bottle feeding on breastfeeding. So they tested different artificial teats on breastfeeding in preterm infants. The mothers of the study participants were unavailable to breastfeed for a certain period of time, maybe because they were very sick, and they wanted to use artificial teats for a certain time without actually terminating breastfeeding. They wanted to see what intervention might work best. So what kind of issues might come up in such a setting? if I was with you in a room, we could start discussing this now and collect your ideas. Given the setting, we'll have to be a little, I'll just tell you what issues I would flag, and I'll also be quite selective because you want to get to your cases and discuss, and we shouldn't be taking too much time. On the next slide, you see a summary of points that come up. This is not to say, this is exhaustive and the only issues that can be discussed, but what might come up is really the issue of the random allocation to the different groups, right? This is something that would need to be carefully discussed in the study design. Is there good reason to believe there is equipoise? Do we think one intervention is superior to the other? Would this be unfair if those vulnerable preterm infants got allocated to a group that maybe had, where we had good reason to think it might be in an inferior intervention? And how could we then also mitigate risks for forming undesirable practice, such as, actually creating dependency, for instance, on bottle feeding? So these will be very specific, and we'll get technically quite quickly, right? And this is why these discussions need really be done in an interdisciplinary setting that many ethics review committees these days actually reflect, because, you need the person who is working on the ground and knows how things are implemented. You need people who really know different interventions well. You need a statistician, you need an ethicist, etc. And you then see on this slide how you can relate those considerations back to the different principles in the EFBRI framework. Maybe let's just have a glance at the second case study so you get a flavor for how you might be able to work with EFBRI. Now, the second study was done in rural Bangladesh. It was a cluster randomized controlled trial. So you take entire groups of people and you randomize groups rather than individuals to certain interventions. And the idea was to actually assess the effect of participatory women's groups on maternal and neonatal health outcomes. And they based the study on a previous cluster RCT. So people were actually, groups were actually randomized and the groups were just kept the same. They worked with surveys and questionnaires, and they found that these women's groups actually do have some beneficial effects on a number of outcomes, including under 5 morbidities. So you think overall, this is not a high-risk issue, right, and a high-risk setup, but you can also discuss, of course, issues that come up in such a setting. You see on the next slide, if you read the paper, the authors themselves flag a few issues that had come up. And one is around informed consent, because these women in rural Bangladesh were consented only through verbal consent, because it was found to be less cumbersome in that setting. And of course, it's a balance to strike, right? You might, of course, researchers didn't want to discourage participation by imposing formal hurdles, like insisting on a written signature when the women maybe felt uncomfortable doing so. So working on a suitable solution that protects participants, also with a view to the risks and benefits of the study, right, is then the job of somewhat detailed discussions. And another issue that maybe unexpectedly came up is this issue of financial incentives. Who should be paid in such a setting and why? And for those people, participating in this research, of course, the issue of remuneration was not unimportant, also because if you participate in such a women's group, you volunteer your time, you maybe have to get to the place, you're not at home as this is happening, you may need someone else who steps in for you at home or at your job, whatever. So they paid the moderators of those groups, but then the other participants in these women's groups started asking questions, well, why they would not be remunerated. And so in a careful research design, you need to also come up with good answers to these questions. Who is actually remunerated for what? Who receives payment for what? And why? And the EFBRI framework shows some general principles in saying, and this is in consistency with Swiss national law, if there is an expected direct benefit, you may not receive payment or any other pecuniary benefit for participation. If there is no direct expected direct benefit, you may be what's called appropriately remunerated. But you see how this does not answer all questions. No way, right? This just points you to a principle that then needs to be specified in the respective context. What does appropriately remunerated actually mean? And then just to flag another issue in a third case study, we're not going to go through the setup here, but just to say this was a study that was done in South Africa and that evaluated the implementation of a feeding buddies program to see if it could promote exclusive breastfeeding amongst human immunodeficiency virus infected mothers. So here you have, of course, an issue of these women being, vulnerable for different reasons. They lived in a slum, and they were also HIV positive. And on the next slide, you see the key ethical issues that certainly should be highlighted is how do you actually provide clinical support management to those vulnerable mothers, and also how can you avoid stigmatization, because this program also involved people going to the homes. So this may raise question, why have they been coming to you? What is this about? So privacy and confidentiality in the study would be of particular concern. And I think it's quite impressive to see how breastfeeding research actually spans such a broad spectrum of potential ethical issues to be considered. Now, to start wrapping up here, on the next slide, you see the specific challenges. The breastfeeding lactation research is really a dynamic and broad research field that makes it quite challenging to be comprehensive in a framework. And we also try with the framework to actually ensure that the research principles meet the principles governing practical implementation. Because we have one world, that's the research ethics world, right? And we have standards and processes for research ethics, but we have much less for actually, just implementing a public health measure. There's much less explicit guidance. There are much less explicit review or any other procedures that guide implementation. And this is something we also hope to address in the near future. The opportunities are to really get explicit user feedback and suggestions from the discussion of real-life cases, which will help build a comprehensive resource. And what we're doing today is a contribution to this effort. And we really want to work towards a global understanding of ethical issues regarding breastfeeding research and facilitate international research and collaboration, review, and funding activities. So finally, just to sum up key messages, the EFBRI is an ethical framework, and this is not a code of conduct. It's really informing an ethical discussion, and it leaves room for some specification and interpretation. Also, what is certainly important is that context matters. Issue may appear and be judged differently depending on cultural, social, economic, and political factors. EFBRI is a synthesis of relevant Swiss and international norms that are relevant to the scope of breastfeeding lactation research. It's not a legal text. That's very important. EFBRI is complementary to national laws. This is not to supersede any national law. It's also not to supersede good clinical practice and safety standards. And it's not a text that's carved in stone. It's a process really involved all of those who are interested in contributing to protecting the dignity and rights of participants in breastfeeding research. And I hope with that you're well equipped for the case studies. Before you'll be going to the small groups, I just wanted to give you a few ideas, a few pointers as to where we are going with our current work. And I'll be very brief here. And you can see that what we want to do is not just look at research, as I just said, but also create an ethics framework for breastfeeding interventions. You will find this coming up very soon on the LactaHub.org website. So please feel free to check in a little while if the new material beyond the EFBRI for research has already been put up. And what we want to do with this new additional framework is really to cover interventions. On the next slide, you can see already our list of key ethical considerations for implementation. And you see, for instance, how conflicts of interest feature prominently there. The issue that you had just heard about in the morning, how issues of what do you do once the intervention is no longer provided, issues of incentives, maybe even more important than in a research context, the ethics of health promotion and communication. So there are new issues that actually arise that may not be as important or not important at all for a research context. And then what we also hope to be doing is what we call, on the next slide, you can see that, the ethical red flags toolkit. We are thinking that policymakers may be thinking, well, I want to do something to promote breastfeeding in my area. I may have a little budget, I want to do something. And then there are seven main clusters of activities in which you may want to, from which you may want to choose. You may want to promote knowledge, you maybe want to work on a new policy or whatever, or want to change attitudes. So you kind of pick an area, and we envisage this as an interactive online system. And on the next slide, you see we will match those key areas with ethical categories that we've identified. And we then want to bring those two together such that, as you see in the next slide, you can say, well, I picked the area of maternal health. I'm envisaging, I want to make sure, there are home visits of women who've recently delivered and who are breastfeeding. So there may be different examples of this intervention. And then there will be a list of the main ethical issues that come up. And here we just have one example, and that maybe you want to prevent harm and risks. And you see then a description of ethical issues that may emerge. So these are the red flags, right? That you may, and you can then judge if they may be relevant to your specific, to the intervention that you have in mind. For instance, one issue that comes up may be that the people who will be doing the home visits witness, for instance, domestic violence. What do they do with this, right? How do they react to this? And is this reflected in the protocol for the intervention? So that's just one example of how we hope to be useful to the research and the community also of implementers. Next slide, please. So what we're doing right now is we will gather feedback for the frameworks. We want to develop those interactive features online. And we are also in the process of conducting case studies to consolidate the existing frameworks on research ethics and then also on intervention ethics. And this is also why we've asked you, or we will ask you for your interest in participating in future validation exercises, because it would be very helpful for us to actually get your feedback on our work. And the final slide is just the slide with the acknowledgements. Dr. Miriam Taibale-Fang has been very instrumental in developing the framework. You see this on the next slide, the final slide, as well as Dr. Supriya Subramani and Rasida Vinay and Dr. Julian Merz, who are also listening in on this event because they're curious to hear what you are going to say later on when we hear back from the case study discussions. I want to thank those two as well for the work on the EFBRI content that we are right now doing on implementation, and also for the assistance in the preparation of the conference presentations. So thanks a lot. If you have any questions, I'll leave it to Kai to moderate to see with timing how we are doing. I'm available. I'll also be available later on once you come back together after the case discussions. So over to you, Kai, and thanks to you for your attention.